Patrick suffers from chronic obstructive pulmonary disorder, and this is the main contributing factor to his current respiratory conditions. He suffers from severe dyspnea, which is a key clinical feature of emphysema. Dyspnea is also a common symptom of left-sided heart failure. This is due to the increase in pressure and subsequent fluid accumulation in the lungs. He also is experiencing a chronic cough, which is a key clinical feature of chronic bronchitis. Furthermore, his 40 years of smoking, which was a key factor that resulted in his COPD, contributes further to his respiratory symptoms. Due to Patrick's left ventricle heart failure, his heart rate has significantly increased to compensate for the decreased ejection volume occurring. Patrick suffered from a myocardial infarction 10 years ago, which has caused his left-sided heart failure. His current heart condition has considerably decreased the efficiency of his heart's ability to pump blood around the body, leaving the blood in the ventricles at the end of each cycle. To increase his body's cardiac output, Patrick's heart rate has increased to 155 beats per minute to improve the ejection fraction of his heart. Additionally, Patrick's COPD is increasing his heart rate as his heart is also trying to compensate for his inefficient lungs. As Patrick struggles to breathe due to his COPD and dyspnea, he is not successfully exchanging gases. In an attempt to improve gas exchange, the heart is pumping faster to increase the opportunities for gas exchange to occur. Patrick's long-term smoking habit caused his COPD to develop. It is believed that Patrick's left-sided heart failure developed independently from his COPD because of his myocardial infarction to a branch of his left coronary artery at age 68. However, the two conditions can potentially have negative impacts on each other. COPD causes oxygen levels in the blood to be low, which can result in extra strain being put on the heart to pump blood and therefore oxygen around the body, subsequently worsening Patrick's left-sided heart failure. Pulmonary alveolar edema occurs when excess fluid builds up in the alveolar spaces of the lungs. This occurs in patients with left-sided heart failure because there is increased capillary pressure, resulting in increased fluid exiting the blood, while less fluid being returned to the heart. This causes an accumulation of fluid in the lungs. If Patrick develops pulmonary alveolar edema, he will experience a worsening in his COPD and increased difficulty in breathing. Patrick is now at a high risk of developing right-sided heart failure, as it is a forward response of left-sided heart failure. During left-sided heart failure, the renin-angiotensin-aldosterone system is triggered, as there is a decrease in the level of blood being pumped from the left ventricle. The kidneys detect this as low blood perfusion and blood pressure, as the oxygenated blood is unable to get out into the body. After the low level of blood perfusion and pressure is identified, RAS is then activated to increase blood pressure. However, in doing so, it causes an increase in pressure on the right side of the heart. Any organ that is put under extreme pressure will eventually begin to fatigue, which in this case will lead to right-sided heart failure. It is believed that Patrick possibly already has right-sided heart failure, as his legs are swollen from the knee down. When the blood is unable to be successfully pumped through the right side, as it has begun to fail, it pools and backflows in the legs, causing edema. In Patrick's blood test, it is shown that his calcium levels are slightly lower than normal. The normal range is 2.15 to 2.60 millimoles per litre. However, Patrick only has 2.05 millimoles per litre. Calcium is critically important in the correct functioning of neurons, because it contributes to the transmission of depolarizing signals of synaptic activity. It is also directly related to the contractility period and plateau phase of heart function. Sufficient calcium allows time for ventricles to completely empty and refill by increasing contractility period and plateau phase time. Patrick's low calcium levels may be an indication of another undiagnosed health problem. Chronic renal failure is a common cause of hypocalcemia. Although Patrick has not been diagnosed with this, many of the symptoms he is experiencing are associated with renal failure. These include his low calcium levels, the swelling in his legs, shortness of breath, and constant fatigue. Earlier, it was stated that his swollen legs may be an indication of right-sided heart failure. However, his low calcium cannot be justified by this. Patrick also has a high glucose level of 8.5 millimoles per litre, which can be an indication of diabetes. Diabetes is a risk factor for the development of renal failure, as is heart failure. There is increasing evidence showing that chronic kidney disease and heart failure can contribute to the development of one another. Kidney failure can also be caused by a loss of blood flow, which occurred when Patrick experienced a myocardial infarction at age 68. Therefore, his swollen legs and other symptoms may be an indication of both kidney failure and right-sided heart failure. Low calcium can cause people to become confused, depressed, and forgetful due to its importance in neurological function. Chronic kidney failure can also cause issues with neurological function, as the kidneys are largely responsible for the excretion of metabolic waste. When this waste builds up in the blood, it can result in confusion, memory loss, seizures, and even coma. An additional blood test result that will most likely be abnormally elevated for Patrick is his blood creatinine level. Creatinine is a metabolic waste that is usually transported to the kidneys via the bloodstream to be excreted in the urine. The kidneys maintain a normal range of blood creatinine when functioning normally. Creatinine levels in the blood are usually a reliable indication of kidney function, and an elevated creatinine level suggests a kidney problem. Elevated blood urea nitrogen levels in the blood can also be an indication of decreased renal function and heart failure. When the kidneys are unable to excrete urea, the blood urea nitrogen level rises. Heart failure as a result of poor renal perfusion can also increase urea nitrogen levels in the blood, as can a myocardial infarction, which Patrick suffered from when he was 68 years old.